we have a situation where we have a hospital that's full of patients, and actually we struggle to enable them to get home or to where they need to be in a timely manner. That causes pressure further down the system. We have patients in our emergency departments who need to be admitted, and we struggle to get them into beds. We have patients who need to come in for planned operations that can't come in either. And we have patients lying in our beds, and particularly elderly patients, for whom the longer they stay in hospital, the worse it actually is for them, and we need to enable them to get back home as soon as they can.
Well, obviously, if you're looking at delayed transfer of care, the majority of people affected are clients who would be our clients, our age group, older people. So anything we can do to help their time in hospital and get them out quickly, it's got to be done.
So I think what's going to be really compelling about it is we've had all the right kind of partners essentially locked into a room with a high level of kind of commitment to solve that kind of problem in its composite kind of parts, and the permissions that also kind of go with that. So there's been a very real sense of enthusiasm that I don't think I've seen on kind of previous occasions, because you've had the right people in the room.
Personally, I got the opportunity to go and spend some time on the ward, and I visited a patient on Ward 9 at Barrow, and actually got to speak to the patient, and it was humbling to hear their story and quite harrowing, really.
I think there's been a lot of progress made. It's been a long 4 days. I think we've really looked at the heart of what happens to our service using patients in hospital, about the length of stay, and looking at particular areas of what we can do to look to improve that and reduce length of stay. Much of that's been around working in an integrated way to really get better outcomes for our patients and service users.
I think they will start to see a lot of difference quite quickly, really. Some of the PDSAs that are being talked about will start to take effect next week, and that's really good, because we know that we have far too many people sitting in hospital beds that don't need to be there, and having a positive effect on that and getting them home or to another place of care where they want to be is really important.
I think it will make a massive difference to patients, citizens, communities across the Bay Area, who will begin to see that there are ways of supporting people outside of hospitals, which is really positive. I think what we've seen is staff who've been energised, enthused and empowered to put things in place, to change how things are done, to just get on and do things, and to challenge their executives.
It does happen. It's happened in other places. And we've put a lot of time in the last sort of 2 or 3 hours in making sure we've got those mechanisms in place to support them, to make sure that it doesn't just sort of drift away after we leave here today.
Having such broad representation from across all parts of the healthcare system in a room has been very, very useful. I think it has engendered a level of enthusiasm and optimism, and I think more importantly a belief that we can have a significant impact and change things for the better.
I came on Monday thinking, is this going to be more of the same? But it's not. It has been really positive, and everybody's been working together genuinely.
So it's not just been 4 days of just sitting and planning. There's been action. People have been out on the wards. We've had our partner organisations in, looking at our processes and coming up with solutions, some of which have already been implemented and some of which are already being tested. And there's many more that we want to go on with following this process.
I think they will see a difference soon, in that they will return home a lot quicker than they already are at the minute. And for the staff as well, I think if we can really communicate out that there is light at the end of the tunnel now,